Recording in progress. Hello, welcome everyone. My name is Trina Becker and this is Beth Bergstrom, and we are your speech therapy PD presenters for today's EPIC case study on developmental trauma, specifically for an adolescent. Before we get started with tonight's presentation, there are a few items that I need to alert you to. This course is 60 minutes and will be offered for 0.1 ASHA CEUs. If you're joining us for the live course and your state licensure requires live CEUs, be sure to complete all sections of the course content page, including the one that says Complete Course, by the end of today on your Speech Therapy PD account. Our disclosures for tonight, our financial disclosures for this course include intellectual property rights and royalties from our BNB SLP Teachers Pay Teachers store and our bbboutique.slp website. We don't have any relevant non-financial relationships to disclose for tonight's course. Questions, if you have those throughout our presentation, please put them in the chat and we plan to address those at the end of the course. And this concludes our introductory material, so we're ready. As I mentioned, I'm Trina Becker, and this is Beth Bergstrom. We both teach at Eastern Illinois University. We are instructors and clinical supervisors in the Department of Communication Disorders and Sciences. We both love to share our passion for this profession through presentations and social media and through creating resources for SLPs. Tonight, we'll be presenting our EPIC case study on developmental trauma, specifically for an adolescent, and we are ready to go. Our learning objectives for this course, we hope that by the end of the course that you are able to critically analyze case history and other information to determine etiology or underlying factors or symptoms. Develop a profile of strengths and needs and functional impact to determine treatment priorities, and to determine most effective treatment approach using client values, clinical judgment, and research. You have for your handout our EPIC worksheet. This is a guide to help you think through the process of developing client-specific intervention. So we base this worksheet on the ICF model from ASHA, and we really just want you to think about the process of arriving to client-specific intervention through thinking about a client's etiology, developing a profile of their strengths and their needs, thinking about the impact of those, considering some clinical questions that will then help you derive at that client-specific intervention. So you have this as a handout for tonight's case, and we'll be walking through that in a PowerPoint for you. Again, our topic is developmental trauma. Our client for tonight is Nate. He is 14 years, 11 months, and the complaint is emotional dysregulation with detachment, and then also parents have some academic concerns for Nate. We're going to start first with etiology. We get a detailed case history from our clients at our university clinic, and this is what we know about Nate. We have limited information on developmental history because Nate was adopted. So his adoptive parents don't have a lot of that birth history or developmental knowledge of him. They do know that the pregnancy was full term, but there was possible substance abuse and exposure during pregnancy. Nate has had several adverse childhood experiences while living with his biological parents, including physical abuse, verbal abuse, emotional neglect, and food and housing insecurities. So he has a lot of ACEs that he has had to deal with in his life. At 5 years old, him and his siblings were taken out of his biological home and were fostered. And at 7 years old, they were all adopted by the same foster family. So they now live together. His ongoing triggers due to that significant trauma, he has ongoing triggers due to that significant trauma, and he is the oldest of all his siblings. He's been seen by some other professionals throughout his years. He was seen by a psychiatrist while he was in foster care. At 5 years old, he was diagnosed with post-traumatic stress disorder and reaction attachment disorder. When he was 11, the psychiatrist dismissed him, and she didn't feel like she could meet his needs anymore at that time, and she was really just doing some medication for him and said, I think this is all that I can do for him. His medications, he does have some for mood stabilization and also for allergies. Just recently, he started seeing a new counselor, so this past summer, and his new counselor diagnosed him with dissociative detachment disorder. So that was a new thing that came up and enhanced his parents' understanding of what was going on with him. So Beth will talk about that a little bit later. And he's now receiving counseling, which is a really good thing for him. He is in general education, but he does have some accommodations through a 504 plan. So he currently does not have, an IEP with IEP goals. He's just receiving some accommodations. He was evaluated by an OT at one point, and the OT indicated some sensory challenges, but he does not have OT services ongoing.
Okay, so what we like to do after we kind of collect all the case history is really isolate the key findings from that etiology. So if I think about Nate, I would say that his key findings are the significant trauma history with ongoing triggers. A lot of his ongoing triggers, he's in a very stable environment now with his biological parents. But he being the oldest of his siblings, I feel like that's where his triggers come from. His younger siblings are still kind of struggling with some different things, and he feels often very responsible for them. So that does serve as a trigger for him in many situations and many times, even just throughout the week. Also, one of the key findings would be this newly confirmed dissociation and detachment diagnosis, which Trina mentioned has been helpful. I think that in the spring, when we finished with him, we still had some concerns about kind of where we were going with him, and having this new diagnosis, I think, is going to be very useful for us in continuing therapy this fall. And then obviously the emotional and behavioral dysregulation is one of the things that is kind of throughout all of his history and throughout all of his observations, we are seeing this dysregulation with him. I would say in the majority of his sessions, and then I think at school, he's probably dysregulated the majority of the time. Thinking about a profile of his assessment now, I want to let you know that he was initially referred here by his parents when he was 11 because they were seeing signs and symptoms of autism and really wanted to have him evaluated by an autism team. We do have an autism team here, and we did that evaluation. He did not meet the diagnostic criteria for the diagnosis of autism at that time. Through that testing, we also did some speech and language testing, which suggested that it really was just that emotional and behavioral dysregulation secondary to the developmental trauma and also some executive dysfunction. This diagnosis that I have listed here of the emotional and behavioral dysregulation secondary to developmental trauma is really about the closest thing that we have to a diagnosis. It's typically how I would indicate that on a report. PTSD is also something that you might find. Just developmental trauma alone is not in the DSM. And so this is about as close as we get. And I think it's a good representation of kind of what we're seeing. So I do like using this as my diagnosis. He also has some executive dysfunction or some deficits in areas of executive function. Just for your information, some test results from that speech and language testing that I think are interesting to point out, which I think could be difficult for some of you who are in the schools, because you're going to see that his language is pretty good. So PPBT 103, he had specific concerns from his mom at different times about short-term memory, saying that he couldn't recall things, he would forget things, he would ask the same questions over and over. I had kind of an inkling that it probably was more dysregulation, but we did testing to rule out any problems with working memory or short-term memory. And that testing did reveal that his memory was within normal limits. His language testing through the CASTLE, all scores were within normal limits except for double meaning. Not surprising, really. And then we got all of our EF diagnoses from 3 different tests. The BADS, the brief, which was filled out by parents, teacher, and self-report by Nate, and also the favors. So we did a lot of testing to kind of support or give evidence for that EF diagnosis.
Beth, do you remember when he was referred for his autism evaluation? What triggered that?
From his mom?
Yeah, what behaviors was she seeing that made her think it might be autism?
She was seeing some like OCD type of things. She was seeing some sensory things. Oh, and he was actually seen by the occupational therapist. You did
Yes.
mention that, but nothing of a big concern. She saw some challenges, but nothing that really resulted in anything related to autism. So I think it was more needing to follow a routine, kind of some of those tendencies for OCD, some sensory things, and then oftentimes dysregulation, really looks like autism.
Yeah, there's lots of overlap in their characteristics.
And we kind of knew that. One of the first things we checked when she referred him for that evaluation was we went to the case history. As soon as we saw the adverse childhood experiences, and how significant they were, it really led us to make sure that we were considering both diagnoses as we were trying to kind of differentially diagnose that. Oh, one more comment here about, I mentioned to you that some SLPs in the schools may have difficulty, because the reason I say that is because language scores are all okay. So if anyone did only the language testing, he would not qualify or be eligible for services probably in the school. So you really have to dig a little deeper, and hopefully those EF skills would be enough to get him the support that he needed in the school. However, we mentioned to you also that he doesn't have an IEP at school. The services that he gets for his diagnoses are from our clinic. He only gets accommodations currently. Okay, this is what we call the fight, flight, freeze, and fawn behaviors in developmental trauma. And this is our profile that we developed a few years ago. So you'll see a lot of different behaviors, and they are divided into 4 categories: that fight, flight, freeze, and fawn. All of these kind of ideas kind of developed from beaconhouse.org, UK. I found that information and had never really seen it anywhere else before. And we really kind of dug into that information, and from that developed this profile. I think this is one of the first places to start. I definitely see it as an assessment. So just while observing a client, you can tally the different kinds of behaviors that you see. I think it's really important that this assessment is done during different times of the day and from multiple raters. So you can see that what I'm showing you here just happens to be our ratings while he was here, but we were able to get teacher and parent ratings as well. From this profile and the behaviors that I tallied, you can see we can determine what kind of profile he is. And he is really a hybrid profile of flight and freeze. He has a few fight behaviors and he has a few fawn behaviors. However, he primarily will present in flight or freeze. So you can see there where the tallies are, kind of what some of those dysregulated behaviors might be. I don't know if I can see them because they're so small.
So you want me to do it?
I can get close enough here. For flight behavior, sometimes he is disrespectful. Sometimes he's unable to follow rules. Sometimes he rushes or panics or worries. And we were able to observe that, or we did observe that in sessions. And right now you're thinking, gosh, I mean, I see that in a lot of clients. How do I know? Again, I'm using what I learned from etiology and case history and how he presents in different environments to kind of make this final decision. This is just part of the assessment. In the freeze category, often distracted, not listening, confused, forgetful. Again, sometimes I'm not sure how confused or forgetful he is, but that he was dysregulated when he initially heard the information, so therefore he did not gather that information. So really important. This client specifically tends, again, I think this is related to him being the oldest of 2 siblings. He's a caretaker. He takes a lot of responsibility on for himself and wants to take care of other people. And that's where that fawn part of this assessment comes in. Some of the things there are pleasing, always smiling, always wanting to fix something, always wanting to help you. And he definitely tends to have some of those things, probably more so with his mom than anyone else. So the key findings from the assessment are emotional and behavior dysregulation, secondary to developmental trauma. We call him a hybrid profile of flight and freeze behaviors. He has executive function deficits in the area of inhibition, self-monitoring, shift, emotional control, initiation, planning, organizing, task monitoring, abstract problem solving. Also, I thought it was interesting to note that during some of the executive function testing, like the BADS and the favors, he would just freeze during those tasks. He didn't even know how to start. Yes, that's initiation, but I also saw some of those dysregulated behaviors interfere with his test taking. And then, did you have a comment?
Nope.
Oh, okay. And then also detachment and dissociation is a key finding from his assessment, not from me, but from his mental health provider during difficult or triggering tasks that interfere with his academics. Again, this is another area that can often be misinterpreted as, an inability to do a task or refusal. Specifically, he is often thought to be maybe gaslighting is a term that I hear sometimes from family members.
And his mom used that one a lot.
Yeah, she did use that. She thought he's just blaming others. He was there, so he had to hear it, and so now he's trying to get out of it. Um, but since we have this new diagnosis, I think it's starting to kind of sink in that it really is nothing related to his ability. It's a neurological response, not something that he really has a lot of control over. And he's missing the information on the front end because when things become overwhelming, he just detaches or dissociates from the situation. So then he cannot learn. So it's not that he doesn't have the ability to learn, but he's just not in a regulated state to learn.
And all these behaviors are happening when he's triggered. Right?
Yeah.
It's important, like what you just said about neurological response. It's a neurological response. He's triggering, he's triggered by something and he's going to a safe space.
Right, exactly.
Right? So you're seeing him go to a safe space by, freezing or by doing his flight behaviors. That's what's happening. That's why he's doing it.
And it's very difficult to kind of isolate those behaviors and to interpret them for what they are, especially if you don't know the history. If you did not know the history, you would not see these behaviors as dysregulated. You would see these behaviors as executive function deficits, truly, or language or bad behavior. Yes, absolutely.
Okay, so let's now talk about impact areas. So this is the part where we go through all of the areas, and I'm going to ask Beth some questions.
And you'll see this on your worksheet, I believe.
Yes. So if you go to impact, Beth, does his deficits, does his behaviors, do they impact auditory comprehension? Is that a concern for you?
No.
Okay. How about oral expression?
No.
How about EF cognitive?
Yes.
I think we know the answer. Speech?
No.
Social?
I think sometimes yes. Yes. I would say yes to social.
Social with peers, social with family members, everyone.
I think it just depends on we're going to watch a video of him talking about how he interacts with his friends.
Okay.
And maybe that will answer that question. I think we need to say yes to social because I think they probably misinterpret some of the way he interacts sometimes.
Behavior?
Yes.
Sensory?
No.
Okay. Written expression and reading comprehension?
Probably, but it's just not our focus right now. I mean, as a freshman in high school, I'm sure that he is going to struggle with both of those things. I think he has the ability to do those things, but whether or not he gets much experience with that because of his regulation, I'm not sure.
Okay. So now we're to clinical questions. Let's think about how this impacts him. So what impairments most impact his daily function?
I think with his age and placement in school right now, it's academic success.
Okay. Emotional regulation and being in a place, attachment to learn.
Yes.
Explain what that means. Attachment to learn.
I mean, our biggest obstacle right now is that he is not emotionally regulated and attached and long enough to learn. So it's not sufficient for learning. He may have moments where he's catching some of the information or lessons, but our biggest obstacle right now is teaching him to stay present for learning.
Okay. What activities are most important for your client?
I think the academic success again.
Yes.
Yeah.
I'm not trying to trick her, I promise. What current characteristics hinder your client the most?
The dysregulation.
And what current characteristics are strengths to build on?
I think with both family and with our client, emerging awareness, which is the number one thing that we need, is awareness of what's happening to him in the moment. I think that we are beginning to have, parents are very supportive and very invested in helping him. However, I think they were starting to get a little frustrated and burnt out on some of the behaviors. Now, with some of the new information that we have from the summer, I think that we are getting some more family buy-in for this whole impact of the trauma and how much it is kind of driving, his wins and his losses. So that is really a strength right now, that we're getting some more family buy-in. And then also this new diagnosis, along with some counseling, I think is going to be a strength. So awareness overall is a strength for us. We need to continue to build that.
But that's because you've done so much education to that family.
We've done so much education, and they want it, they need it.
Mm-hmm.
They need it all the time.
And they need it to be continuous, because I think when you started with him, they were getting it, you were talking to them about it, but was it sinking in? Was it making sense?
Right.
Were they really realizing what was happening? And it took multiple times of saying the same thing, talking about it in different ways. This new diagnosis has really made, understanding. So we're going to talk about that later in intervention, but education was huge for this family, and that's why it is a strength now, because you've done such.
Yeah.
You've been so diligent about it.
Talking about an adolescent, so you can imagine that the burnout is real. I mean, we start to make some gains, and then we continue to have the same struggles. And so I think that they need continued and consistent support. Right now, I feel like you're probably all saying, is this our job?
Yeah.
Is this our job to do this? We feel very strongly that this is our job. It's related to learning. It's related to communication. And I just don't know who else is qualified. It's a neurological kind of thing. Who else is qualified to do this? They need you. They need you to recognize it and to support them.
And I know with this client, we're talking about EF deficits. Obviously, that's within our scope of practice. But for other kids, it might be language, it might be language skills that you're working on delayed. They might be in speech therapy for that. And you have to realize they're not going to get anything out of therapy if they're dysregulated the entire time. So that is also why that falls under our scope,
right?
Because not just with Nate, but other clients as well, they have to be regulated for them to be able to learn, to be able to even benefit from speech language therapy. So we've been asked that question before when we present on this topic, and they're like, is it our job to be dealing with this behavior all the time? And we always say yes, and think about it. I mean, if it's sensory, like we're doing sensory, right, to get our kids regulated. For our kids with ASD or other kids, we're doing some sensory stimulation, because we have to get them in a place where they can learn to be able to even participate.
And, we're talking about neurodiverse individuals. And with all of those individuals, the big push right now is to make sure that they are regulated first before we do anything else. So I think this is just another example of a neurodiverse diagnosis that we need to make sure that they are regulated, and that is our job.
Okay, this leads us to thinking about intervention for this client. So we have developed this idea of a coping framework for helping you figure out goals and for thinking about intervention for your clients that have a history of developmental trauma. We actually have a full presentation on this coping framework on SpeechTherapyPD.com. So if you want to learn more about it, you can go watch that. I think it's a 2-hour presentation. So if you're interested, catch that. Coping framework. So we love a good acronym. So this is our acronym for how you approach these clients to get to intervention. So the C is for case history review. As we did with Nate, we have to identify history of ACEs. That's really important. So I know in the schools you don't always get a good case history. I think this is something really important to talk to your social workers about, those counselors that help you gather that information. So if you have your domain meetings and you know that that child is in foster care or that child has been adopted,
It matters.
It matters. And I would really encourage your social workers or whoever else is in charge of doing those interviews with parents to really get some good background information about what are their ACEs, right? What have they experienced? And that will help you realize that you need to be looking for some of these behaviors. So that's first, always most important, not most important, but very important. Next is observation. So you're going to observe the client and think about, are they demonstrating any of these fight, flight, freeze, or fawn behaviors? And then going to apply that profile. So you're going to look at the behaviors and start to categorize them. Like, again, what we saw with Nate and how Beth walked through that, looking for specific behaviors. We have that profile available on our Teachers Pay Teachers store. Beth also referenced the Beacon House website that is on your handout at the very bottom, I think, within the methods. So you can go there. That is a fabulous resource. That's where you went to even start learning about this.
Some of the educational pieces within that for you and then also for your parents are just amazing.
So check that out. So that's what we're doing for our profile. Next, as you're working with the client, you're going to start to identify behaviors in action and you're going to name them. So these go together, this ING, these 3 parts go together. So while you're working with them, you're going to say things like, I see that you're in flight. I see that you're in flight right now because you are doing whatever skill that you're doing. It doesn't matter what age your client is. If they're 3, if they're 11, you're going to do the same thing. You need to be attaching a name to what they're doing. And so that they start to realize and, make connections with those behaviors that they are triggered and what's happening with them. And then the next thing you're going to think about are the strategies. So we also have some strategies within that fight, flight, freeze, and fawn profile. We have strategies that go with each of the different dysregulated behaviors, things that you can try that will help get your client regulated and in a place where they can learn. So be thinking about this when you have children with history of ACEs, thinking about observing, identifying those behaviors, calling them out within the session, making sure parents are aware, encouraging them to do the same thing at home, and then practice implementing those strategies across educational setting, parents, and in therapy so that everybody's kind of aware and doing the same thing.
Just a little kind of brief thing about awareness. This is part of our instructions for filling out the profile. Children with a history of ACEs display behaviors that are often misinterpreted. That fight, flight, freeze, and fawn are dysregulated responses to a child's environment, situation, or an expectation that is placed on them at any given time due to that developmental trauma. If a child is demonstrating dysregulated behaviors, the child is most likely not learning at that time. Therefore, individuals like you who are working with these children need to be able to recognize these behaviors as dysregulated and not bad behavior. So I think it's just kind of that whole idea of awareness is such a big piece and understanding what you're seeing.
I think we have to be advocates for these kids too, because I think Beth mentioned, like, who else is going to do it, right? So
yeah,
we need to be their advocates.
And trust me, these kids are very difficult in a classroom, of 20. Very difficult. If they are a child who is showing more freeze and fawn behaviors, they're probably not bothering anyone And so sometimes it's really easy to overlook that dysregulated behavior. If they are in fight or flight, they're probably removed from the classroom. So they're also not learning. So it's just a really tricky thing. You need to catch them and then you need to apply the strategies for them, but it takes a lot of practice. That's why they need you. And you're gonna need that collaboration with the classroom teacher or aide or anyone else who's working with them.
Those freeze and fawn behaviors where those kids are going to be overlooked, possibly, I think you're going to see it then come out in academic concerns, right? That they're not doing well in the classroom because they're not in a place where they can learn, they're not remembering, they're not listening to instructions because they are in that dysregulated state. And so that's how it's going to show up.
One of the biggest descriptors of kids like this is inconsistent performance. Because sometimes they can do it and sometimes they can't. And that is very frustrating for a teacher and a parent. Well, he could just do that skill yesterday and he can't do it today. I don't understand. He's not trying. Those kinds of things come into play. So inconsistent performance is a red flag for this as well.
And that's when you think that they're making a choice not to do it because they did it yesterday. They're choosing not to do it when really they're not choosing. They're just trying to get in a safe place. Because they're triggered.
So we are arriving at some client-specific intervention here. So now we're on to some example goals. I want to walk through a few things. I'm going to start with some of the dysregulation goals and then move to a few examples of some EF goals. We're not really here to tell you how to do these things, but I think it's nice for you to see some of the goals that we've written in the past for this client. So a long-term goal for regulation might be that the client will regulate their behavior for full participation in all learning activities and environments, which leads you then to a short-term goal that you can kind of measure here. Not kind of, that you can measure. When prompted, the client will identify fight, flight, freeze, or fawn behaviors with 90% accuracy. So if I see one of these behaviors, I might say, stop. Let's look at your profile of all of your behaviors. I want you to tell me what you're doing right now. And he may say, I'm changing the topic. And then I say, okay, what category is changing the topic in? Oh, that's in flight. And then I say, yeah, you're right. You are in flight mode right now. So you're not learning because you're in flight mode. So I need to say stop. So when prompted, tell me what's happening. And then I want to know if they can identify that behavior. Okay. Then client will participate in a co-regulation strategy with 100% accuracy. I'm going to jump ahead for just a second, just so that you have a visual of the strategies, and then I'll go back up to the goals. This is the strategy page that goes with the profile. So if you have fight behaviors, I've given a list. Again, a lot of these have been adapted or modified, or I've added some to it that have worked for me with my clients from that Beacon House list that they have. So if you have a client with fight, this is a list of things you could try that might help regulate a child in fight. The ones that have the arrows next to them happen to be the ones that tend to work best for this particular client. So if Nate is in fight behavior, I might stop what we're doing and really go to some easy, familiar chore or work that needs to be done. I might give him a crunchy snack. That tends to work for him too. Our goal is to practice these co-regulation strategies, meaning they need your help to initiate them because they don't have the experience to do that on their own. And then we're working toward them being able to regulate their self. If they are in flight, you can see a lot of different options here. The ones that tend to work best for Nate are chewy foods, give him an important task, or slow down whatever I'm doing and really say to him, okay, you're kind of all over the place. Let's slow everything down and let's restart. In freeze mode, the one that tends to work the best for him is a fidget toy or some kind of sensory item. So I may have a bag of those and I see him kind of doing some of those freeze behaviors and I say, okay, I can see it. Let's choose something from this bag and let's use that while we're trying to finish this task, or even just take a few minutes to do that sensory item before we get back to our task. And then in the fawn, some of the things, I think this is a really tough one. Again, I mentioned that I think he has the fawn behaviors because he is a caretaker. He wants to kind of take care of his family. And it's really important to let him know that he is just a child and he is not responsible for anyone but himself. And so it's really important to set boundaries, to let him know that, I can take care of this myself. Sometimes I say, this is just too much right now. Let's just take a break. So those are some things that we identified that are really useful for this particular client. Okay, let's go back up to those goals. So you can see that I want him to participate when I say, okay, I see it. We're going to identify it. Now here's your choice. What would you like to do? Let's practice this co-regulation strategy. He did not like to do one every time he had a dysregulated behavior. So for him, we usually did, like, if I saw 3 to 5, then I would say, okay, you've lost all control here. We've got to take a break and try this. He wanted to always try to push through. I think that I let him push through a little bit, but I felt it was really important for him to know that it was okay. One of the really interesting things we did that was really useful is we walked around to people in our clinic, and he did a survey of, first of all, the dysregulated behaviors that people have. We all have dysregulated behaviors. We get triggered by certain things in certain moments, and we all get to our boiling point. So he asked people to tally their own dysregulated behaviors. He happened to come to me on a day that was not a good day, and I told him things like, I threw someone out of my office. I threw something on the floor. I, yelled. I don't know. And then he's like, well, what did you do? What, are you okay? That's what he said to me.
Yeah.
He said, are you okay? And then he said, so what did you do? And I said, I had to put everything down. I got up and I took a walk. So he went around and did a survey to make sure that we wanted him to make sure he recognized that everyone has to do regulation strategies at certain times and how important it is. And it's nothing to be embarrassed about. It's nothing to be self-conscious about. And it really helped, I think, him.
Yeah, that was such a good activity.
I love that. Okay, some client-specific intervention or some framework for executive function goals. Really important to always consider, explicit teaching, direct instruction, breaking tasks into small steps, scaffolding, support, practice and generalization, real life and real-time scenarios, and maybe not even scenarios, but actually real life things going on in a certain moment. A lot of times kids who have a history of trauma and dysregulation have a hard time imagining something might happen. They kind of fixate on the fact that, well, that didn't happen. So actually you need to really kind of see something unfolding in the moment and be flexible enough to kind of jump on that. Even scenarios don't really hit it every time. And then, self-regulation is part of EF. So, I mean, you're still doing some self-regulation during those EF tasks. Another, few things that we've done through EF with him are some task monitoring, some self-evaluation. Those are all parts of the EF framework as well. So some specific goals in that area are the client will improve planning. Of course, this is related to academic tasks. We try to use his own curriculum or curricular work because it just makes sense. So we give him a homework assignment and we want him to summarize the instructions. So his own homework assignment that he has from class, and we want him to be able to summarize that in his own words. We want him to identify all necessary materials needed to complete the assignment. Again, some of these goals came directly from mom saying, the night before the project is due, he's like, I need a poster board. And I'm running out to the store, to Walmart to get poster board at midnight or whatever. So we try to talk about getting him kind of organized. And then also formulating a plan for academic tasks. The next is just to improve problem solving and also cognitive flexibility. So we give kind of a scenario and we state the problem. Again, we've had some trouble with the scenario piece of this in the past, and we're trying to kind of adjust that a little bit this semester and making it more real life. We want to also have him state who the problem is a problem for and rate the severity of the problem. That again was something that we came to that kind of goal by talking to mom. She's like, he's like, it's no big deal. He thinks turning work in late is no big deal. They said I could turn it in late. I have accommodations for turning things in late. It's no big deal. And so having him understand the severity of those problems is really important. We like to talk about the cause, of course, of the problem and generate goals for different tasks. And then also one of the things with cognitive flexibility that we found was really useful for him was demonstrating or discussing different uses of common objects, being creative. We are trying to work on some of that imagination and creativity and flexibility within his cognition.
I was going to say, with the client-specific goals that you wrote, you were doing a good job of incorporating the parents and what are their biggest concerns and what are their biggest issues. I know working in a school, you're not going to always have access to those parents, but you do have access to their teachers.
Yeah.
What are they concerned about? What do they see as the child's, what are they struggling with the most? So you can develop your EF goals based on teachers, and then hopefully get a little input from parents as well.
Definitely. Okay, just have a few videos here so you can kind of see what this looks like in action. So this is one of our first days with this client in teaching him how to identify behaviors. So you can see on the table is the profile. We've kind of taken it down into some things that we already have identified to make kind of the list a little smaller for him. And we want to talk through those so he can identify it. So this is the first day of kind of teaching him about fight, flight, freeze, and fawn.
What FF? Sorry.
Yeah.
I always have to say that this is one of our graduate students. So this is her first time doing therapy with this type of client ever. And she's doing an excellent job.
You're going to be impressed.
What F behaviors are. Have you ever seen this?
Flight, freeze, fawn.
Have you ever heard about this?
Nope.
No?
But he has, because he just said it.
We're going to break it down. Like, have you ever talked in school about when your brain is like a working brain or a focused brain or anything like that, and then sometimes your brain isn't working, you have too much going on? Have you ever talked about things like that at school? Or at home?
Mm-hmm.
No? So we're going to use brain online and brain offline, okay? So brain online is going to be like you're super focused, you're trying to work your way through the task, you're not distracted, you're able to get through, you're working through, and you're comfortable while doing it, okay? And brain offline is going to be when you're struggling to get through, you're not focused, you're bringing up other things, you know what I mean? Like sometimes
These are like a mixture of positive and negative emotions.
Yeah, you're right.
Okay, so just some education and some awareness of the vocabulary that we're going to be doing. Okay, here we have an example of him beginning to self-identify. He asks some really great questions about what does that even mean? I think this is important.
What else do you think you do? I'm going to put a check mark here, okay?
Okay.
What are other ones you think you do? Oh, really?
Like I do them all.
Yeah, I haven't read any of them. Besides that, they smell silly.
Okay. Why don't you put a check mark?
I can be aggressive.
Okay. Do you think you're aggressive everywhere?
Like, I silly bully my friends. Is that what it count as bullying?
I don't think so. I think that's more so just being silly.
Okay, what's hyperactive mean?
That means when you're super energetic and you can't relax, kind of.
Not very often, but I am sometimes disrespectful.
Okay.
I panic of tests and races.
Okay.
Rush.
Rush means like you're always rushing to the next thing and you can't relax and you're just trying to make it through. You're always trying to go to the next thing.
Okay. I can worry. What do you mean with excessive movie?
So, like if say our situations were flawed, you're me and I'm you, and you're giving me an assessment like the memory test. And I'm sitting here like,
Oh, fidgety.
that could, yeah, fidgeting, excessive moving, excessive.
Okay, so I really like this whole idea of him kind of talking through, and he's always got like a rationale for like, sometimes I can. I don't know if it's this one or the next one, but he talks about, well, is it always bad to be, I think it's the next one. I'll be quiet and let you hear it.
Right now? I think your brain is offline right now.
Is silly a bad thing though?
I don't think it's bad, but it just means that your brain isn't online.
That is so true.
You know what I mean? Like, it's not a bad thing to be silly and fun. I love when you're silly and fun. I sometimes, well, not right now.
Okay, so he's like, that is so true. I think this is a really important one. Sometimes the clinicians will say to me, how do I know if it's just silly or if it is dysregulated? And I always say, you can be silly, but if it's interfering with your ability to complete a task, then it's probably dysregulation. So if it's impacting your ability to do something, it's probably more of a dysregulated behavior than just being silly.
I think that clinician does an excellent job of defining.
I know.
She
I
really does,
know.
like
It's
on the
off
spot,
top of her head. I know.
defining things.
Okay, so the next video you're going to see is him starting to get practice with some of these co-regulation strategies. And he does not love it at first. He really doesn't.
And figure out what materials you need. We'll see if she has any details about the project. Okay, I'm gonna stop here. And your extra movement might mean that we might need to stand up. We might need to take a break for a second. Maybe we need a fidget. Maybe we need to go get a drink of water. What do you think? I feel like we have a lot going on here. I don't know if we're being successful working through this right now because our brain is offline.
Can you like fold, like?
Go through them?
No, I meant put them face down and spread them across.
This one doesn't work. Here, let's put it here.
I close my eyes and whichever one your eraser falls on is the one. Oh, actually, the other one. Try to fidget.
What's new in that bag? I got 3 new things.
So we already had an idea of some of the things that were working for him. And so he got to just have some choices. He didn't really want to make his own choice. So he just randomly chose one. We learned a lot more about those as we continued to practice with them. One of the best things that we learned for him, and they also tried to incorporate this at school, is that as soon as he enters a room, mom would say that his worst or most difficult times were right when he gets to school, after lunch, and then also after PE. And so right when he would get into the room, into our session, we had a sorting task of any kind, like literally sorting colors, sorting shapes, sorting silverware, sorting wood from metal. I mean, just random sorting. It was mindless. We'd set the timer. He would do a 5-minute sorting task, no talking. He wasn't allowed to talk. So he would come in for the session. He knew exactly to sit down and set the timer and do his 5-minute sorting. And then he was ready to work. And then they started to implement that into, he could pull something out of his bag right when he got to school, sit down and get himself regulated. He started to have more success with that self-regulation. Once we found some things that really worked for him. Some other things that were useful in school were if he started to feel like he was getting dysregulated, he was allowed to pull like a word search out of his bag and take just a few minutes to kind of find 5 words, and then he would put it away and try to be more regulated. They weren't always successful, but it was definitely kind of a step in the right direction versus just sitting there and tapping his pencil and getting everybody else kind of going. And then he's getting in trouble for disrupting everyone. And so it definitely was something that was working for him.
And I think the first day you tried that sorting task, you were blown away by how quickly, really, he was able to get regulated and ready for therapy. She's just down the hall from me. So when great things happen in therapy or whatever, we share ideas. And I remember you saying, I can't believe how well this worked.
Yeah. Yeah.
Right. And so that was a pretty cool thing.
Well, and then we shared that with mom, and she's like, I don't believe it. I need to see it. And so we actually had her come in, and he told her about it and told her what he liked about it. And she was like, oh my gosh, I kind of have seen him do things like that at home. And so they started using it at home too. He was kind of the laundry sorter at home. He was kind of the put the things away from the dishwasher at home. And he really liked kind of that order to kind of calm his brain.
Quick question about, these different strategies that you have. You tried many of them with him.
Yes.
And did you do that he self-rated or that he commented on how well it worked, or was it mostly the clinician observing if it was effective or not?
Mostly the clinician observing. However, we would say things like, did you like that one? I mean, we would definitely ask him, but really we can see a change in him almost, immediately after he's done a regulation strategy or not.
Okay.
Sometimes if he started one and we were like, this isn't really getting us anywhere, we might stop it in the middle and try something else. It was almost like you could see it immediately. And then we would say, what did you think about that one? Should we add that one to our list of things that we should try next time? And then we would continue to try those and get practice. And this is very early on of us doing that. So we're not really sure quite yet which ones are working.
Okay.
Overall, I just think it's important to know that kind of the ultimate goal here for these kids with dysregulation is to catch them before they slip. We want to use co-regulation strategies paired with behaviors of fight, flight, freeze, and fawn, and we want to practice, practice, practice. Our ultimate goal is to keep them in their learning brain, and we want them to eventually be able to do that on their own. I think that it's very important, and it might not feel so good to point it out every time. And I know that clinicians have told me, I just feel bad, telling them you're being disruptive or you're doing this, but in our 45 minutes twice a week, that needs to be our focus and we need to do it. And a lot of times will just remind them of that. I'm going to pick on you. If I see it, I'm going to do it to prepare them for it. But we have to find a way to keep them in their learning brain so that they can benefit from teachers. They can benefit from SLPs. They can benefit from life lessons. This is our ultimate goal. Some specific methods that you might want to look into. Of course, I've got regulation methods. You can find those on Beacon House. You can find those from our materials on Teachers Paid Teachers. Also, just knowing that one of the biggest methods is going to be education and collaboration. Education, always. Parents need to know what you're doing, why you're doing it, where you're getting the information. There has to be buy-in from the parents, from the teachers, other professionals, and from the clients themselves. She mentioned earlier that it's important to start this training of vocabulary and awareness, at 2 and 3. I've done it as early as 2, where I start to talk about some of these things in an appropriate way. It's really important for them to know the cause of the behaviors and using words like this is neurological, this is not bad. Collaboration has to be consistent with everyone that is involved with this child. You need to talk to them on a regular basis about what's working and what's not working. If you can get counseling, even better. So look into kind of what your options are in your area, assist your clients in kind of finding those connections. So that would be really, really helpful. And then with EF methods, I mean, mostly we're looking at organizational tools, self-evaluation tools, breaking things down, graphic organizers, all of those things that you're more comfortable with probably than some of this other stuff. Continue to do some of those EF methods as well.
And I would say if your school is not trauma informed, maybe you need to be the leader and get everybody on board and start this education process with them in collaboration, because it's probably unbelievable how many kids are in their classrooms that have adverse childhood experiences, that are exhibiting some of these behaviors. And for some educators, for some parents, it's going to take a lot of education to convince them that they're not being bad. or they're not, trying to do this, they're not making the choice to do this, that this is just a response and that we need to treat it differently because regular punishment strategies, maybe some other strategies that they might use with other kids are not going to be effective. And in fact, it could make them even be triggered more so. So
Yes.
huge importance to do this education to all involved.
And I often hear trauma informed. I mean, I sometimes say, what do you know about trauma? And they said, oh, yes, I'm trauma informed. Trauma informed is almost different than learning what we just talked about. Sure, you're all aware that there is trauma out there, but now we're talking about what do we do about it? How do I help? So be cautious about, yes, I'm trauma informed.
Okay, we're going to pull up some questions now that are in our chat. Oh, somebody said, love our t-shirts. Our t-shirts are regulation before expectation. We designed these for when we did this presentation for our state association. They're available on our website if you love them. So we're matching Twinkies tonight. Is there a way to verify if we have our address in our profile? I'm not sure what that was a question for the tech people. Sorry. Do we have access to the PDF of the slideshow? No, but most everything is in that handout that we have. And then we listed the resources for other things. Why am I struggling? Let's see. Let me see.
You can't use that someone else's laptop. It's too hard.
That's right.
I'm not sure if this is the case, but ours requires that students be eligible under SLI only under the areas of semantics, syntax, morphology, pragmatic, language, voice fluency, and/or articulation. Can you share about when executive function or dysregulation falls under the SLP's area to access versus that the school psychologist, mental health therapist? Do you want to start?
Nope.
Yeah, I mean, it's tough, but what about other health impaired? Is that a eligibility criteria, other health impaired?
That is an eligibility criteria. Would you also think that EFs fall within language? Do you think it fall under that category a little bit within like
depending maybe more cognition. So I really feel like could it not be SLI?
Well, she's asking, I think, who's going to assess that? Are we assessing that as SLPs in our area or school psychologist, mental health therapist, or OT?
Oh, I feel like there's always going to be more than one thing going on, and I really feel like you're going to be the one assessing it. I think this is not the first time we've had this question, and I don't think we ever have a great answer.
Right. I don't know, you could make it fall under all these because EFs are controlling all of these different
Daily
parts of language
yeah.
and daily functioning and the ability to.
We talked about that one of his main, problem areas was social and behavioral. And so I don't know if that helps in any way, shape, or form. Yeah, I think this is a really difficult question. We need to prepare a better answer for this.
We do.
We're going to write ourselves a note and we'll do that. I apologize for not having a better response. Although I do know that it's very different everywhere. Everywhere
Right.
you are,
Different
it's
schools,
different.
yes, different schools have different guidelines.
And then, yes, I know it's a tough question. Do you find that there are children who experience similar diagnoses, obstacles that were young during COVID, children who missed preschool? I think yes. I think that is one of the ACEs. I think that it is traumatic and they did miss some experiences that are now overwhelming for them. For developmental trauma, there are certain stipulations on kind of when that happened and how many adverse childhood experiences. It's important to know that you could have two kids that experience the same exact trauma, and one of them might have adverse childhood experiences that result in dysregulation, and one might handle that stress better and therefore not have dysregulation. So a child's response to stress is what's going to determine how dysregulated they are and how triggered they are by different things. But yes, we've talked often about the trauma of COVID for some kids.
And that point you just made about they can experience the same thing and react differently. You took the words out of my mouth.
Good.
It's good stuff. Just Nate's siblings have different behaviors than he does. They react differently.
They also say that depending on the type of abuse that you experience, there are some abuses like neglect that are sometimes worse than physical abuse. And, so it's important to we mentioned those that he had in the beginning. And as hard as it is to hear some of those things, it's important for you to know what kind of trauma they experienced.
Somebody commented that defiance often is not recognized as dysregulation.
Oh boy, do I
Amen
have a
to that.
client that could be like tattooed on my forehead while I'm seeing him. Yes.
You're so right. It's understanding the reason they're doing it, right? What's the cause? We always come back to that. Why? Why are they doing it?
And defiance, I think it's a defense mechanism, right? And again, we all have a small amount of acting really poorly when we're in defense mode. And then we're sorry for it later. I mean, we all have a little bit of this, but you talk about these clients that have, multiple adverse experiences that are trying to be young children trying to deal with this. I mean, it's really hard. You talked a little bit about discipline, which we didn't get a chance to really go into how you discipline different, but oftentimes these kids are placed in the wrong school placement where they have to earn different things. That's not the kind of discipline that's going to help these kids. They need a different, and then you'll hear from the teachers, well, we do it all the same. If they're in this classroom, this is how everyone earns recess or how everyone earns, a popsicle at the end of the day or whatever it is. That causes even more dysregulation in kids. So, I mean, it's just not easy.
Messages. Okay, we got more
Okay.
messages. You scroll because I can't do your laptop.
Okay.
Lots of questions.
OHI would be determined by the school psych. Okay, thank you. So, but then that could also be part of your eligibility for seeing them, correct? Under OHI, the speech therapist could also do that. The psych would, thank you. Yes. Okay. The handout, do you have more specific link for regulation methods? The link goes to the homepage of Beacon House. Yeah, regulation methods you can find again in the information that we have on Teachers Pay Teachers. Also, Beacon House has many handouts within. You said you went to their homepage. If you scroll through, you're going to find several regulation methods there. There is a toolbox or gosh, I almost wrote his name down because it's gonna elude me now. My book that I have in my office that I also got some really good things from. I can't think of his name right now. I don't know what it is. So yeah, you're welcome, except I'm not able to give you that specific name. But there is not a ton of information out there. You're going to have a hard time finding. Babyfold.org is another website that we often go to in our area to kind of find information. It's on your handout as a resource.
Under collaboration.
Yeah.
You'll see that website there. That's a great one for parents to go to.
It is.
To get some information there and to
get some services, to get services. Yeah. Okay. Feel free, if you have more questions, to email us. And I think our email is somewhere on here, or find us on social media, and we can definitely try to give you more specifics. Maybe on social media, I will post the name of that book on there so that everyone can see it and you can kind of check that out.
Okay, I think that concludes for tonight. So thank you so much for joining us. Remember, if you are joining us live and your state requires live CEUs, make sure you fill out the sections on the course content page before the end of today on your Speech Therapy PD account. We will be presenting next month, so be sure and catch us on our next EPIC case. It's the last Tuesday of the month.
Last Tuesday.
Thank you so much for joining us.
Thank you.